So if you've made the decision to have surgery in Dallas and your surgery is going to be at Pine Creek, then this video pertains to you. I've made a video about traveling to Dallas and my experiences. So if you need any information or advice in that area, please review that video to see if it's helpful in any way. But this is just about the Pine Creek experience and some of the things that I learned in my 2 stays there. First of all, you need to think about what you're going to pack, which I think this is almost overwhelming for all of us as we want to make sure that we have everything. So I'll just tell you what I packed and what I forgot. I decided to wear a gown while I was in the hospital just because I had problems with pain associated with wearing almost any kind of pants other than soft yoga pants prior to my surgery. And so I was concerned about anything being in the incision area at all. So I purchased a gown and took that with me. I also felt it was important to have a personal item with me, something from home. And I had a favorite throw that my mother-in-law had given me, and I freshly washed it and everything so it smelled like home. Those are just things that I treasure. That's just the way I am. I took a robe for the times that I was going to be in a gown. I forgot slippers, which are almost impossible to find in September in Texas. I actually had to buy men's slippers because, come to find out, women's slippers are just a seasonal item in Texas. Because I did a lot of walking, and you'll be up a little bit over 24 hours after your surgery if everything goes okay. So consider slippers or something with good tread on them just so you have stability. Don't want to be wearing any of the nice fuzzy socks and stuff that I like to wear around the house because they'll be slippery. I took a couple of like Sudoku puzzle books and word search books just in case, but didn't use them at all. And I took little travel items like the temporary throwaway toothbrushes that you can buy and stuff like that, because I knew that for the first 24 hours I was going to be laying flat. So everyone, please be aware of that. That's for your cerebral spinal fluid system to refill and all the nooks and crannies, and also to provide a little bit of time for any sealing and healing, as I call it, of your dura. It does help a little bit. You'll be flat for almost 24 hours, and when I say flat, I just mean your head. You'll be able to move, like I was able to lay on my side and such. I didn't have to lay flat on my back because that was a big concern for me, because I couldn't lay flat on my back before surgery and I didn't know what was going to happen after surgery. So I spent a lot of time on my side. You just had to keep your head flat. They'll start raising you up. I think the first raise is like a 35-degree raise, and then they'll monitor for a headache. And if you have a headache, you'll need to go back down, because that's indications that, you know, your system may still need a little bit of time to fill up. And then, you know, over time, you'll get to a seated position in the bed, and then you'll be ready to go walking with physical therapy. But back to the other stuff. Sorry, I get sidetracked. That's the way my brain works. One thing that was surprising to me is you have to take all your medications to Pine Creek, because Pine Creek is a very small hospital and they have a very small pharmacy. And so there were actually a couple of my medications that basically they used the whole time I was there. Your medications will be separated out as to controlled substances and then all your other medications. And the controlled substances will be locked away in a safe, and you will not get them back until you're discharged. So be aware that any pain medication you have or anything like that will be locked away for your entire stay. One thing that I think is important to bring up that was a lesson for me was Pine Creek also does bariatric surgery, and so they have muscle milk available for the bariatric patients at breakfast, because the food at Pine Creek is absolutely amazing, and you'll get a menu each day to pick what you want the next day. Protein is incredibly important for our bodies, especially when we're healing from surgery. And so I always requested a muscle milk with my meals, and they were glad to accommodate. So think about doing that if you can tolerate muscle milk, because it'll make sure you get your protein in, and that'll be helpful in your healing. The thing to remember is that when you are at Pine Creek, you know, Dr. Feigenbaum is your surgeon, and he will do your surgery there. But you are a patient of Pine Creek Medical Center. And so you have a attending doctor that is assigned to you, and you may have one during the day and at night, and you have nurses that are assigned to you. They are Pine Creek employees. They do not work for Dr. Feigenbaum. And so basically what will occur is you will go in and you will have your surgery with Dr. Feigenbaum, and basically you will see him a couple of times after that, like once the day after and the next day maybe, for updates. But your care is being managed by Pine Creek Medical Center. So it's important to know that, because it becomes very confusing as far as chain of command. Like if you have problems with them, you know, I had real problems with them giving my medication at weird times, like not giving me my muscle relaxers at a certain time and things like that, because I kind of prefer to take my muscle relaxers PRN, and they had them like at these weird times. And so it was confusing, because at first I was like calling the, you know, Dr. Feigenbaum's office, but that's not how it works. You need to realize that you are a patient of Pine Creek, and the attending doctor is actually the doctor that you would use for that kind of stuff. You will. Another thing that I think is important to bring up is your pain management, because before I had surgery, my pain management needs were very high, and my daily pain medication use was, you know, high level. I was on a 50 microgram fentanyl patch, and my breakthrough medication was Dilaudid in 8 milligram tablets. And so it was very important for me to get across to them that my tolerances and my normal daily use of my medications needed to be considered when ordering my after surgery pain medication. And so I called the office and talked to both Haley and Katie, I believe, about the fact that, you know, this is the medication I'm on, and that needs to be considered after surgery. And I talked to the anesthesiologist about it. So if you are on you know, a fairly high dose of opiates now, and you're going to have surgery, consider going ahead and getting them informed of what you take, especially if you take something that is a rare medication or not usually prescribed, like methadone, because, you know, I know methadone has a horrible stigma to it, but methadone is actually quite useful in the management of chronic nerve pain. But, you know, I don't know that they would actually have that available at Pine Creek. So all that needs to be considered and talked about, because that's the last thing you want is for your medications like that to be changed around after surgery. You will lay flat after surgery. It's not that bad, so don't think it is. You may or may not have a drain, and you'll have to contend with that. When you get up to walk, you'll still have a catheter in. You'll wake up with a catheter after surgery. And truly, I cried tears of joy when I woke up from surgery and I could feel my catheter, because my urethra was numb. And so the fact that I could feel it and it was uncomfortable was an amazing feeling, as weird as that sounds, but I know that you guys will get it. I didn't, unfortunately that was fleeting. After I had my emergency surgery, I no longer had the feeling again, and I'm still having issues with that, but I'm still incredibly blessed. They will take the catheter out after you walk, and you'll have a certain amount of time before you have to actually empty your bladder and they recath you. I think it was 4 hours. And know that, you know, if for some reason you can't empty your bladder and you have to be recath, it's really for the best. You know, urine retention, especially after surgery, is a dangerous thing. And so, you know, don't think of it as a bad thing. I highly suggest you doing a thorough bowel clean out before you have surgery. No matter how you do it. You want to do a colonic, smoothies. I use milk and magnesia, good old mom. That's what I've always used. I did not have time to do a thorough flushing of my system before my emergency surgery, and it made my recovery so much worse. My first recovery, as far as my bowels, was a breeze because I had cleaned everything out, and I highly recommend remembering to do that and taking care of it. It makes a world of difference. You'll be discharged after probably 2.5 days, depending on how you're feeling. And, you know, you'll go to the hotel, and, you know, please watch my video on CSF leaks after surgery and kind of what to look out for. One of the things I did forget to take with me was a thermometer, and I really highly suggest that you bring one. Otherwise, you'll need to buy one, because you really need to keep track of your body temperature after surgery. Because one of the, you know, two of the big complications that we are worried about should be CSF leaks and an infection or meningitis. And meningitis will present with a low-grade fever at first, headache. Just, you know, the headache could be like the, you know, a leak headache. And in some cases, people, when it gets a little bit more advanced, will get a really stiff neck. But anytime you get a fever after you have surgery, no matter what kind of surgery you have, you need to be calling the doctor immediately. And you need to call them no matter what, whether it's a headache, whether you're having problems moving your bowels, whether you're having problems emptying your bladder. You need to keep them informed of all issues after you have surgery. You know, you'll have a follow-up appointment, and at that time you'll either be released to go home or not. And really consider if you're comfortable going home or not. You know, if you've had a relatively uneventful recovery at the hotel, it's probably okay. I will tell you that I really kind of had an uneventful recovery after mine, and then I started having complications like 24 hours after I returned home. So when I went back for my emergency surgery, I stayed in Dallas for almost 3 weeks because I wasn't taking any chances. I wasn't coming home and going right back again. But, you know, it's just a decision you'll have to make. I can't think of anything else regarding Pine Creek other than, you know, my experiences with Pine Creek were amazing. I had a hiccup with the anesthesiologist in my aftercare as far as pain management, but I think that was a common issue back when I had surgery, and from what I can gather from the groups, it's been resolved. I haven't seen anybody else reporting about that, so that's a good thing. But, you know, just remember, if you're having surgery, that you need to call the office with any issues you have. I can't stress that enough. I hope this has been informative. These are just my experiences, and I'm sure that I've left out a ton of things. So please leave feedback or pointed questions, and I'll be glad to answer them. Thanks. God bless.